Next, we're going to talk about the endocrine system, the placenta change. There's a decrease in hormones that are produced by the placenta. So essentially, as soon as the placenta comes away from the placental site and fourth stage of labor, you have a dramatic decrease in the estrogen and the progesterone. It's lowest at 1 week postpartum. So these hormones are lowest at 1 week postpartum, the estrogen and progesterone. And moms also experience just severe diuresis. So they have a lot of urine output, and they also have a lot of sweating at night. Metabolic changes, they have a decrease in their blood sugar, and if they are diabetic, that is insulin dependent, they have a decrease in their insulin requirements. As far as the pituitary hormones and ovarian function, prolactin remains elevated in women who are breastfeeding. Ovulation in 27 days after birth is normal for non-lactating women. And those that are lactating or breastfeeding is the same thing. Ovulation is delayed up to 70 to 75 days. The increase in prolactin that nursing mothers experience is what suppresses ovulation. Also, the breastfeeding pattern determines the return of the mother's menses. So the more that they breastfeed exclusively, the length of time the baby nurses, moms who do not use supplementation, their menses will take longer to return than maybe a mom who's had to go back to work and is not pumping as often as her baby was breastfeeding before she did return to work, or if she's supplementing with formula. So because of this, it's important to discuss contraception with both lactating and non-lactating mothers. Normal renal glycosuria disappears by 1 week postpartum. As far as fluid loss, postpartum diuresis occurs of the extracellular fluid. And again, decreased estrogen levels contributes to profuse night sweating. And moms may have a urine output of up to 3,000 milliliters for the first 2 to 3 days postpartum. Urethra and bladder. Immediately after birth, excessive bleeding can occur if the bladder becomes distended. And the reason for that is a distended bladder prevents the uterus from having those normal contractions after delivery to decrease bleeding. Moms can experience stress incontinence where they don't have control of their urine. And this can be caused by tissue trauma, if they had a large baby, or if they pushed using the Valsalva technique, which is where they take that big deep breath and hold it till the count of 10. And all of those can contribute to stress incontinence. Immediately after delivery, mothers are just super hungry. It's related to a lot of things, but usually they've been NPO during a long labor or a long induction. As soon as their recovery period is over after, that 1 to 2 hours, depending on how the mom's doing and hospital policy, they are usually just starving, and they've usually been depriving themselves of some of their favorite foods. So it's most beneficial to let them, especially in the middle of the night, the hospital cafeteria is closed and they're not interested in cafeteria food anyway, to let their support person, whether it's their mother, their husband, their boyfriend, significant other, go out and get them whatever they want to eat. Bowel evacuation. Normal defecation occurs 2 to 3 days after childbirth. Just note the anal sphincter, if there are lacerations or episiotomy, are associated with postpartum incontinence. And moms anticipate that it's going to be very uncomfortable, and so, it's important to do a lot of teaching around how to decrease constipation, and as far as, normal to get a stool softener, and then just from all your other courses, how to prevent constipation, and that teaching is important. As far as The breastfeeding mothers, for the first 24 hours, they produce colostrum. The colostrum transitions to milk within 72 to 96 hours, so that's when the moms refer to as what their milk is coming in. Engorgement comfort measures for lactating mothers are important. Those are covered in Chapter 25 that Mrs. Adamson lectured for you all at the beginning of the semester, so you just review that. As far as what would be covered on this test, it's going to be what's in these chapters. So, non-breastfeeding mothers, engorgement usually resolves in 24 to 36 hours after their milk comes in, and it's important that they avoid any type of nipple stimulation. The next system is the cardiovascular system. First, we're going to talk about blood volume. We've talked about how moms have an increase in circulating volume, increase in their H&H. That is a buildup during pregnancy, so moms can compensate for the, pretty massive blood loss that occurs at every normal delivery. So during a normal vaginal delivery, moms lose between 300 and 500 mLs of blood, which is a 10% volume loss. And during a routine C-section, they lose between 500 and 1,000 mLs of blood loss, which is close to 30% of their volume. And just know that these are normal and that moms can compensate for this. This is normal blood loss that moms compensate and don't have any problems. In your book, it listed that the normal postpartum changes that occur increase circulating blood volume. So there were 3 normal postpartum changes that occur, and these occur to increase the circulating volume. The first is elimination of the uteral placental circulation, so the blood that would normally have to circulate to and through the placenta is pushed back into mom's blood volume. The second is the loss of the placenta endocrine function that causes vasodilation, so that vasoconstriction pushes the blood volume back to mom. And the third is mobilization of the extravascular water, and so that pushes that back into mom's circulating volume. So those are 3 normal changes that occur that allow moms to compensate for what appears to be a pretty significant blood loss after delivery, but just know that that's normal. Cardiac output. The immediate blood loss does not decrease the cardiac output. Because we have that compensatory influx of nearly 500 mLs of blood into the system, which are those 3 normal postpartum changes that we just talked about. For postpartum vital signs, if you want to look on page 478, which is table 20.1, it lists vital signs after childbirth, and those are important to know so you can recognize normal from abnormal. Blood components. The H&H decrease after delivery, and they return to normal by approximately 8 weeks postpartum. The white blood cell count. A count of 12,000 is normal during pregnancy, and so after delivery it's normal to increase between 20 to 25,000 by, around day 4 to 7 postpartum, and that can be easily confused with sepsis, so you don't just look at a WBC count. You have to take into consideration her other vital signs and how she's feeling, but that can mask the signs and symptoms of sepsis. Coagulation factors. They increase during pregnancy and postpartum, and because of this, moms are higher risk for DVTs, so you want to do prophylaxis to prevent those. And the last thing on this slide talks about the varicosities, and those are common in the legs and the rectum with hemorrhoids, and those usually disappear after delivery. The respiratory system was pretty straightforward. You have an immediate decrease in the intra-abdominal pressure at birth. This decreases the pressure on the diaphragm, which causes a reduced pulmonary blood flow. Chest wall compliance increases, and that decline in progesterone occurs with the loss of the placenta, causes the the partial pressure of carbon dioxide levels to rise. The neurologic system, the changes are a result from reversal of maternal adaptations to pregnancy and from trauma during labor and birth. So pregnancy-induced neurological discomforts go away after birth, and a good couple of examples are carpal tunnel syndrome and nasal stuffiness. Those go away after birth. Headaches are common in the first postpartum week, and you have to, figure out what's causing them. They're usually bilateral and frontal in nature as far as the location. They can be caused by postpartum preeclampsia, stress, or leakage of cerebral spinal fluid as a result of an epidural or a spinal. The musculoskeletal system, the adaptations are reversed. Joints are stabilized 6 to 8 weeks after birth, but you'll have moms ask about their shoe size, and it's common that the increase in the shoe size is actually permanent, so your feet do not shrink after delivery. As far as the abdomen, it returns to pre-pregnancy state approximately 6 weeks after birth. Striae, or the stretch marks, may be present. The return of the muscle tone is dependent on what mom's previous muscle tone was, if she was exercising before, and how much adipose tissue she has. Diastasis recti abdominis, this is where during pregnancy it's usually a very large baby, or it's usually related to having multiples, is that the abdominal wall muscles separate. This usually goes, over time they kind of shrink back and align. Just know that usually there's no treatment needed. So moms usually do not have to have surgery to treat the diastasis recti abdominis, although it's very concerning to moms. As far as the skin, the Malaysia mask of pregnancy usually disappears. The hyperpigmentation of the areola and the line that goes down their abdomen may not completely disappear. Vascular abnormalities regress, so spider veins and those type of things usually regress. And hair loss is often reported during the first 3 months postpartum, and so that's normal. So, it's normal to get a phone call into the doctor's office with moms complaining of their hair falling out, and it's just important to, explain to them that that's normal. So if you do that type of teaching on discharge, you may prevent those phone calls and moms worrying. The immune system is mildly suppressed during pregnancy, and it gradually returns to its pre-pregnant state. This rebound of the immune system can trigger flare-ups of autoimmune conditions such as MS or lupus. And here are the key points of the chapter. And we'll end this chapter with a practice question. Which vital sign deviates from the normal reading as a result of postpartum sepsis? And the answer would be A, temperature. The diagnosis of postpartum sepsis is suggested if a rise in maternal temperature to 38 degrees Celsius is noted after the first 24 hours after childbirth and recurs or is persistent for 2 days. Other possible causes are mastitis, endometritis, urinary tract infections, and other systemic infections.